government has not been handling it appropriately. That motion was struck down in the Parliament. The committee is not moving forward. Let's have a listen to the Prime Minister.
Content d'être ici ce matin avec les docteurs comme toujours et les ministres Duclos, Anand et Leblanc pour répondre aux questions.
Other ministers to answer your questions. The lives have changed a great deal for youth who are still trying to find their place in the world. This change is particularly difficult.
Earlier this week, I had a chance to speak to high school students at the Ottawa Catholic School Board's Virtual Academy. We talked about what this pandemic has been like for them, their family, and their friends. And just like young people always do, they had a lot of great questions. One student, Leah, asked how long it would be until we have a vaccine for COVID-19. As I told Leah, we're coming at this from every angle, whether that's investing in Canadian research or securing the world's most promising candidate vaccines. This morning, I want to let Leah and her class know, along with everyone else who's following this, that we're taking yet another step forward. Today, I can announce that we are investing $214 million for Made in Canada vaccines. To begin with, our government is providing up to $173 million for Medicago to advance their vaccine candidate and create a production facility in Quebec City. We have also reached an agreement with them to supply up to 76 million doses of their vaccine. This is about securing potential vaccines for Canadians while supporting good jobs in research. On that note, the second part of today's investment is for the Vancouver-based biotech company Precision Nanosystems. They're also making progress with a vaccine candidate, so we're allocating up to $18.2 million for their development and testing. The final piece of this Made in Canada investment is over $23 million through the Industrial Research Assistance Program for earlier stage vaccine candidates being developed across the country. From Dartmouth to Burnaby, Canadian researchers are doing great work, and we're here to support that. Le savoir-faire canadien
Canadian know-how is one of our best assets in the fight against this virus. That is why in April, we invested over $1 billion in a Canadian plan to mobilize science to fight against COVID-19. In this plan, we invested in the Strategic Innovation Fund, which supports researchers across the country in the development of vaccines. Today, we are making another step forward. We will provide up to $173 million to Medicago to work on its vaccine candidate and to establish a production facility in Quebec City. Our government has also signed an agreement with the company to obtain up to 76 million doses of its vaccine. We will also invest up to $18.2 million in a vaccine candidate from Precision Nanosystems in Vancouver through the Industrial Research Assistance Program. We will invest over $23 million in other vaccine candidates across the country.
Of course, it's not just Canadian researchers who are working on vaccine options. Around the world, the best and the brightest are coming together to find a solution to this pandemic. Canada has direct agreements with a range of vaccine developers for their most promising candidates. And through our investment in Gavi's COVAX facility and advanced market commitment, we also have access to additional doses for Canadians as part of their international program. When a vaccine is ready, Canada will be too. Alors que la mise au point des vaccins se poursuit,
while vaccine research is being pursued, we will continue to use the tools available to us to ensure people's safety. Our government is working tirelessly to help the provinces and territories increase their testing capacities. And today, I have good news to announce on that matter. We have just received hundreds of thousands of rapid testing kits from Abbott, and we will be deploying them across the country. 2 trucks transporting the second rapid test kit, ID Now, have also just arrived in Ontario, and others will be following shortly.
We received hundreds of thousands of the Abbott PanBio rapid tests, which are currently being distributed across the country. 2 trucks of the other Abbott rapid test, ID Now, have also arrived in Ontario, with more coming soon. In the weeks to come, we will continue to support the provinces and territories as we get tests out to the front lines. I want to end today by talking about where we are with this pandemic and where we need to go from here. Yesterday, Canada had the highest ever number of new cases of COVID-19. We have to get these numbers down. This is serious, and everybody must do their part. Your loved ones with pre-existing conditions, your parents, your grandparents, they're counting on you. Our frontline workers, our nurses and doctors, they're counting on you too. People's lives are at stake. We can't afford to be careless or think that this virus will just go away on its own. So please, keep following local public health guidelines. Please wear a mask and keep your distance. And if you haven't already, please join the 4.8 million Canadians who've downloaded the free COVID Alert app. We flattened the curve once before. We beat that first wave and saved lives. I know we can do it again.
Yesterday, we had 2,738 new cases of COVID-19 in the country. That is the largest number to date in one single day. We must reduce the spread. People's lives are in danger. We cannot be careless or think that the virus will just leave on its own without us working hard. So continue to follow public health officials' guidance on wearing a mask, keeping your distance, and download the free COVID Alert app. We were able to flatten the curve in the spring, and I know that we can do it again this fall. Thank you, everyone. I now give the floor to Dr. Tam. Good morning to everyone.
There have been 209,148 cases of COVID-19 in Canada, including 9,862 deaths. Nationally, there are close to 23,500 active cases across the country. And over the past week, labs across Canada have tested an average of almost 75,000 people daily, with 3.1% testing positive. The average case count is now at 2,488 cases being reported daily in the past 7 days. The number of people experiencing severe illness continued to increase. Over the past 7 days, there were on average just over 1,000 individuals with COVID-19 being treated in Canadian hospitals, including over 200 in critical care, and an average of 23 deaths were reported each day. Last week, Dr. New and I had the honor of speaking at the opening of the Canadian Public Health Association's annual conference, which was held virtually this year. It was an opportunity to reflect on what we have been through collectively over the last 10 months. But most of all, it was an opportunity to thank Canada's public health workforce for their extraordinary work and their commitment, resolve, resiliency, and ingenuity. It is truly inspiring, and I just want to take a moment to acknowledge their efforts today to all Canadians. Canada's public health community has mobilized and collaborated like never before to stand up and sustain this response. We've all had to adapt and adjust as new information emerge, while at the same time navigating through the sea of uncertainties. And yet, the public health workforce has endured and remains steadfast in the commitment to protect and improve the health and resilience of the populations we all feel privileged to serve. But despite public health efforts, no one sector can solve a pandemic alone. Pandemics are whole-of-society events. That means the impacts extend across society not only by affecting those who become ill, but also by impacting the health, social, and economic systems that affect our overall well-being. It also means that minimizing the pandemic's impact both today and in the future depends on all of our actions now. The longer a pandemic goes on and the less we all do to minimize the related disruptions, the more its impacts will be felt. The public in public health means, as practitioners, we serve the population, but also that the collective actions of the public are a vital part of the power and success of our solutions. We can all do our part by keeping our numbers of in-person close contacts low and committing to proven effective public health practices. Stay home or self-isolate if you have any symptoms, maintaining physical distance, wear face mask as appropriate, and keep up with hand, cough, and service hygiene. Go the extra mile by downloading the COVID Alert app to break the cycle of infection to help limit the spread of COVID-19. Thank you. Merci.
Bonjour à tous et à toutes.
Good morning, everyone. There have been 209,148 cases of COVID-19 in Canada, including 9,862 deaths. Nationally, there are close to 23,500 active cases across the country. Over the past week, labs across Canada have tested an average of almost 75,000 people daily, with 3.1% testing positive. The average case count is now at 2,488 cases being reported daily over the past 7 days. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average just over 1,000 individuals with COVID-19 being treated in Canadian hospitals, including over 200 in critical care, and an average of 23 deaths were reported each day. Last week, Dr. Tam and I had the honor of speaking at the opening of the Canadian Public Health Association's annual conference, which was held virtually this year. It was an opportunity to reflect on what we have been through over the last 10 months. But most of all, it was an opportunity to thank Canada's public health workforce for their extraordinary work and their commitment, resolve, resiliency, and ingenuity. It is truly inspiring, and I just wanted to take a moment to acknowledge their efforts today to all Canadians. Canada's public health community has mobilized and collaborated like never before to stand up and sustain this response. We've all had to adapt and adjust as new information emerged, while at the same time navigating through the sea of uncertainties. And yet, the public health workforce has endured and remains steadfast in the commitment to protect and improve the health and resilience of the populations we all feel privileged to serve. But despite public health's efforts, no one sector can solve a pandemic alone. Pandemics are whole-of-society events. That means the impacts extend across society, not only by affecting those who become ill, but also by impacting the health, social, and economic systems that affect our overall well-being. It also means that minimizing the pandemic's impact, both today and in the future, depends on all of our actions now. The longer a pandemic goes on, and the less we all do to minimize the related disruptions, the more its impacts will be felt. The public in public health means, as practitioners, we serve the population, but also that the collective actions of the public are a vital part of the power and success of our solutions. We can all do our part by keeping our number of in-person close contacts low and committing to proven effective public health practices. Stay home, self-isolate if you have any symptoms, maintain physical distancing, wear a face mask as appropriate, and keep up with hand, cough, and surface hygiene. Go the extra mile by downloading the COVID Alert app to break the cycle of infection to help limit the spread of COVID-19. Thank you.
Merci beaucoup, Dr. New. Le Premier ministre va répondre
Thank
aux
you
questions
very
pour 20
much,
minutes
Dr.
aujourd'hui.
New.
On
The
commence
Prime
par le
Minister
téléphone.
will
Le
respond
ministre
for
Dr.
questions
disponible
to
pour
questions
répondre
for
aux questions
20
par la
minutes.
suite.
Dr.
The Prime
Tam
Minister will
is
be answering questions today for 20 minutes, starting with the phone. Ministers and doctor will remain available for more questions afterwards. Opérateur, on commence par le téléphone. C'est à vous.
operator. We'll start with the phone. You have the floor.
Thank you, merci. First question, Jamie Pashagomskom from APTN, line open.
Hi, Mr. Prime Minister. Thanks for my question. My question is for the Niskantaga First Nations. They've been on a boil water advisory for the past 25 years. I was wondering if you're going to be able to stick to your 2015 promise of lifting all water advisories by 2021. I think you said March.
Thank you, Jamie. Since 2015, we have worked incredibly hard to lift long-term boil water advisories across the country in Indigenous communities. We've lifted around 95 of them so far. Many of them had been in place for decades. We recognize there's lots more work to do and numbers more that we need to lift off those long-term advisories. Travel restrictions related to COVID have made it more difficult in certain situations, but we continue to work very closely with communities across the country, with partners. We continue to invest and flow resources so that we can do this. This is a commitment that Canadians expect of this government and one that we expect of ourselves. We will continue to work extremely hard to lift those long-term boil water advisories as soon as possible.
Following up, Jamie.
Yes, thank you. I'm just wondering if you could confirm or not, are you going to be able to stick to your deadline, or are you going to have to push it back?
As we know, this is a commitment that matters an awful lot to us as a government, but matters even more to Indigenous communities across the country that have gone, in many cases, decades without safe drinking water. We have lifted well over 90 of them so far. Some of them had been in place, indeed, for decades, and we're working extremely quickly to try and resolve all of them. Understandably, COVID-19 and the travel restrictions have come and created challenges in certain communities and certain paths forward, but we continue to be optimistic we're going to be able to lift those remaining boil water advisories soon.
Thank you. Opérateur, prochaine question au téléphone.
Thank you, merci. The next question is from Heather Schofield, Toronto Star, line open.
Good morning, Prime Minister. It's Heather here. I'm wondering, you've expressed concern in the past about a smooth transition of power in the United States, and I'm wondering if last night's debate, which was a bit more traditional in tone, gives you any reason to have a little bit more confidence in the process?
Well, I have always had confidence in Americans' capacity to move forward in a successful way. They've been running elections successfully for a very long time, and we are certainly hopeful that everything will go smoothly, regardless of the outcome in a few weeks. As a government, however, I think Canadians expect for us to prepare for a range of contingencies, and we are, but mostly we are focused on ensuring that regardless of the outcome, regardless of who is president in the coming years, we will be able to continue to stand up for Canadian interests and make sure that Canadians are protected during this COVID-19 pandemic and beyond.
So just to follow up.
Repeated in English, our responsibility as a Canadian government is always to ensure that we are there to protect Canadians' interests, regardless of the results of the elections in the United States. Obviously, we are looking at what is ongoing. We are preparing for any eventuality, but I am confident that we will be able to protect the safety and interests of Canadians, regardless of the result in 2 weeks.
Yes. Could you just articulate for us what you do see as the Canadian interests in a smooth transition? I mean, it seems, I guess, kind of obvious to all of us. How would you list them?
Well, I think seeing the systems in our largest trading partner continue to function smoothly is of interest to all of us. We've been able to work closely with this administration on many important issues to Canadians. We've stood up for trading relationships. We've defended aluminum and steel workers. We've continued to advance important issues to Canadians both domestically and around the world. And we will continue to work with the United States on that, regardless of what happens in the election coming up. Obviously, as a government, we prepare for multiple contingencies and multiple outcomes and look carefully at the different proposals by potential presidents to make sure that we're able to stand up for Canadian interests. We've done that through sometimes challenging situations over the past years, and we will continue to do that into the future.
Merci. Opérateur, prochaine question au téléphone.
Thank you, operator. Next question over the phone.
Thank you, merci. Prochaine question, Catherine Lévesque, La Presse canadienne, à vous.
Question. Yes, good afternoon, Mr. Trudeau. I'd like to hear your thoughts on President Trump's comments yesterday that said he was aware of distributing a COVID-19 vaccine by the end of the year. Is that also your assessment? In Canada, in Canada, we have worked very hard to ensure that we can have access to vaccines when they are discovered around the world. We've signed 6 agreements with a number of companies throughout the world for candidate vaccines. We have also participated in the COVAX initiative, which gives doses in Canada when we purchase for the developing world, because we all know very well that Canada cannot come out of this pandemic without the entire world coming out of the pandemic. We hope that a vaccine is forthcoming. We are working with a number of these countries to ensure that we can guarantee that it will be safe for Canadians, and we are confident that we will be able to distribute this vaccine responsibly. It's certain that in the beginning, there will be fewer doses than we will need for the entire Canadian population, but gradually, as the year progresses, we will obtain more. Everything will be done in an orderly fashion, but I don't think that people should expect there to be a vaccine ready to be distributed before the end of the year or even the beginning of 2021.
We've worked extremely hard with companies around the world to secure Canadian access to vaccines. We know many different companies in different parts of the world are working really hard to try and find and develop a vaccine for COVID-19. Canada has been able to secure agreements with 6 different companies around the world and secure access to further companies through the COVAX facility, which ensures vaccines for Canada, because we're also supporting vaccines for the developing world. These are initiatives that make sure that those vaccines arrive for everywhere, particularly vulnerable countries, when they're most needed, because we can't get out of this until everyone gets out of this. Canada has an excellent portfolio of vaccine potentials, but we also know nobody's got that vaccine yet. There are still trials going on. There are still a number of companies, some closer than others, but we're waiting to ensure that those vaccines are effective and further that they will be safe for Canadians. Nothing will be distributed in Canada until Health Canada is absolutely certain that the safety of Canadians is being properly covered and taken care of. We are hopeful that the vaccines will arrive yesterday, but they won't. There's still a number more months of work to do. I think the reasonable expectations is that vaccines could start to arrive sometime in the new year. But even then, there will be smaller amounts of doses that will have to be distributed to priority populations. I think of our most vulnerable or our frontline workers. And we have experts busy evaluating exactly how and where and in which way to distribute these vaccines. We will, of course, be working closely with provinces and territories to ensure that it's done the right way. We all want to get this COVID-19 crisis behind us as quickly as possible, and that's why we're working on vaccines responsibly, safely, and quickly. But at the same time, Canadians need to know every step of the way their government will continue to be there for them. We will do whatever it takes for as long as it takes to support Canadians while we get through this crisis.
En suivi, Catherine?
Follow-up, Catherine. Question. Yes, I'd also like to come back to rapid testing that we're receiving. I would like to know how the distribution to the provinces is going. Is it done to the population? And have you obtained a consensus with the provinces and territories on who will have access to these rapid tests in priority? Is it northern communities or maybe health workers, for example? Answer. Northern and remote communities already have access to rapid testing. We have been using rapid testing there in communities where distances are large and the challenges are enormous in terms of testing. But yes, we are speaking to the provinces about the distribution of rapid testing. What is important to know is that they are part of a testing strategy that has a number of levels. A number of these rapid tests are slightly less effective or less precise than the current testing that we have. So it is important to be able to use them to maximize their impact on outbreaks and control of COVID-19. We're obviously in conversation with our partners in the provinces and with experts to ensure that we use them in the best way possible, because in the beginning we want them to have the largest impact possible. Thank you. We will now turn to questions in the room.
David Aiken, Global News. Good morning, Prime Minister. It's been exactly 1 month since the throne speech in which your government made some commitments on long-term care facilities, and I wonder if you could update us on where you are at in introducing new criminal code amendments and where you're at in talking to the provinces about new long-term care facility standards.
We have had 20 First Ministers' meetings since the beginning of this pandemic, and in my last one, we had a good discussion around sharing best practices across provinces. We've seen that certain areas are having greater success in controlling the spread of COVID-19 in vulnerable populations, like in long-term care facilities. And I think the first step, and one of the advantages of a federation like Canada, is we can learn from each other on how to deal with particular challenges. The federal government recognizes provincial jurisdiction in this area, but we also know that protecting Canadians' lives and dignity is all of our business, and we will continue to work with the provinces to make sure that seniors right across the country feel safe where they live and that family members know that their loved ones are being properly protected.
And if I can just come back to the situation with the Neskatanga, specifically the Neskatanga, not other commitments. In December 2015, your government promised that community that it would build a new treatment plant by 2018. That delay got pushed to March 2019. It's now October 2020. They have a water crisis. Now they've got a confidence crisis that the evacuees in Thunder Bay don't believe you that you will get a water built for that community. Can you talk to them and say what's going on?
Reconciliation is something that is extremely important to this country, and it is a process that will involve many steps forward and a few setbacks. It is difficult, as we all know, to end these long-term boil water advisories. Otherwise, other governments would have done it. We've managed to lift 95 of them, have dozens more to go, and we're continuing to work very closely with all communities involved. I can't share with you exactly the details on this particular community, but I can assure you that Minister Miller and others are working extremely closely with that community in order to resolve this crisis that they're facing right now.
Merci. Prochaine question.
Thank you. Next question. Question. To conduct a follow-up to my colleague's question about the rapid testing, I would like to understand, when someone in Quebec City or Vancouver, when will they be able to obtain this rapid testing exactly? Are we talking about a matter of days or weeks? And what would you say to the opposition that doesn't understand why it's taking so much time to deploy these tests? Answer. It depends entirely on the strategy implemented by the province in question. we have rapid testing, we have more precise testing, the way that the province chooses to use its resources and offer this testing to its inhabitants depends on their situation and their overall testing strategy. Our responsibility as the federal government, as it has been since the beginning, is to deliver these tests to the provinces to ensure that Health Canada approves tests that are safe for Canadians, that to use them to fight against outbreaks and the second wave and other possible future waves of COVID-19. But as far as the strategy for using these tests goes, we are working with the provinces, and they are the ones who have make the ultimate decision.
The access to rapid tests will vary across the country depending on the strategy put forward by the province in question. Rapid tests are one element, have advantages and also disadvantages, and need to be part of a whole strategy on testing, on tracing, on controlling the spread of COVID-19. The federal government's responsibility has been to ensure that these tests get approved and get safe approval and then go to the provinces. We have begun distributing them to provinces, but the provinces will need to determine the best way to use those tests. There are strategies that need to be put in place to balance the needs of certain areas, the various processes available in order to control COVID-19 in the best possible way. And while we work with the provinces and give encouragement and recommendations to the provinces around the best strategies there, ultimately it is the province that will decide how those rapid tests get deployed.
You can go ahead.
Good afternoon, Mr. Prime Minister. Isman Hamidi with the Canadian Press. I want to ask you also about testing. Why should we be confident that this testing plan is as safe for Canadians as quarantining? And why travelers should get priority in testing where there are obviously backlogs in the testing system?
The responsibility of the federal government is to ensure the safety of all Canadians. And I can understand that people would want to have every newfangled solution that they hear about on the internet available to them as quickly as possible. But Health Canada, and I think all Canadians, expect that the work be done to ensure that when we begin to distribute medical services or equipment like tests or eventually vaccines to Canadians, we can be absolutely confident of the safety for Canadians of what we're doing. Yes, we're in a pandemic. Yes, we have to move quickly, but every step of the way, the safety of Canadians will always be paramount. We've moved forward in partnership with provinces on delivering rapid tests, and we'll work with them to develop as they develop the strategies for actually rolling out those tests to maximum impact in the community. As we move forward, we're also seeing, for example, a pilot project in Alberta around business travelers and looking at different quarantine times for people arriving, including airport testing. We're interested in seeing the results of this pilot project, but it is only a pilot project. As we move forward into the coming months and perhaps look at loosening some of the border restrictions internationally, we will be able to have data to rely on to make sure that we are, first and foremost, keeping Canadians safe and controlling the spread of the virus. That will always be our top priority. Nous savons que les gens veulent
answer in French. We know that people want to have access to all sorts of possible technology and equipment that they see on the internet that might help put an end to this pandemic. But Health Canada and we as a government must ensure that everything we approve, whether they are tests or vaccines, are safe for Canadians. There is nothing more important, and it's a task that we take very seriously. We are happy that that we were able to approve rapid tests that are being distributed to the provinces, but we recognize as well that it is up to the provinces to establish the distribution strategies and access to vaccines to draw the maximum benefit from them possible with a restricted number of rapid tests. We will receive more, but we need to maximize their impact from the beginning. At the same time, we will continue to ensure that everything we are doing targets the long term. We just signed a pilot project with Alberta on business travelers being tested immediately and perhaps have a shortened quarantine. It's a very limited project, but it might help us establish further measures at our border when we eventually decide to remove some restrictions. We'll have data that we can base our decisions on to protect the safety of Canadians at all times.
Glenn McGregor, CTV News. Prime Minister, you've been saying since the spring that aid is coming, some kind of aid package is coming for the airline industry. Wondering how close you are to that now, to aid specific to the airline industry, not general aid to large business, and whether it's going to have any kind of requirements for servicing underserved routes and also compensating passengers who have invested money in airplane tickets and not being able to use them because of the pandemic. Will that be a requirement of any kind of aid for the airline industry?
The details are still very much under discussion and in reflection. We moved right away, as you pointed out, Glenn, to help all industries across this country. And with the wage subsidy, which the airlines and the airline industry certainly made use of, we delivered well over $1 billion in direct aid to the airlines because we know that supporting workers through this pandemic is extremely important. There are certain industries that are harder hit than others because of this pandemic. Travel and tourism is certainly one of them. And that's why we continue to discuss on ways forward to ensure that we're going to have a strong airline industry coming back. But my largest preoccupation is always going to be for Canadians themselves, for workers and for people in rural, remote, or even not so rural or remote regions like Atlantic Canada that are seeing significant reductions in airline service, to make sure that they continue to be well served through this pandemic and after this pandemic. This remains a priority that we continue to work on.
Answer repeated in French. We have supported workers in all industries since the beginning of the pandemic with measures like the wage subsidy. For the airline industry, it was over $1 billion that we gave directly to them to help support workers. We recognize that some industries, such as the aeronautics and airline industry, have been struck particularly hard by this pandemic. So we are in continual discussions with them on other potential aid packages. But my major concern, and our concern as a government, will always be, first and foremost, on assistance for Canadians. That is, for Canadian workers, and also for Canadians who are concerned that during the pandemic or even after the pandemic, they will not have the same air service that they had before. It's a concern for us to ensure regional service, and we will continue to work towards that goal.
Hi, Prime Minister. Tom Perry with CBC. There's a report out just now that the National Chief of the Assembly of First Nations is calling on the head of the RCMP to step down because of her comments about her officer's conduct in Nova Scotia. I'm wondering if you've heard this call from the National Chief, what you think of the RCMP Chief's comments and your response.
The responsibility of the RCMP is to keep Canadians safe. We have seen some challenges in Nova Scotia, not just recently, but over the past many months with the terrible tragedy in how the RCMP has been able to deliver. But at the same time, they continue to serve Canadians day in, day out, right across the country. I've heard concerns from many Canadians about the functioning of our national police force, and we'll continue to listen to Canadians and work with the Chief in terms of the Commissioner, in terms of making sure that we continue to keep Canadians safe. Je sais que
Answer repeated in French. I know that what happened recently in Nova Scotia and what happened a number of months ago with the terrible tragedy has raised concerns about the RCMP. We will continue to work to ensure that the RCMP is protecting Canadians and properly serving Canadians. This is a work that I'm doing with the Commissioner, and we are all doing together to ensure that all Canadians are well served by our National Police Force, which continues to keep Canadians safe each and every day.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui.
Thank you very much, Mr. Prime Minister. That's all the time we have today.
On va maintenant retourner au téléphone pour les questions.
We will now return to the phone for questions. Next question.
Thank you, merci. Prochaine question, Émilie Bergeron, Agence QMI. À vous.
Question.
Oui, bonjour.
Yes, good afternoon. Perhaps Mr. Duclos could answer this question concerning the investment in Medicago. The Prime Minister mentioned the facility in Quebec City. Can you give us a bit more details on that? How many jobs might be created, for example? Answer. Thank you very much for the question, and I can tell you that the word that comes to mind is pride. We're very happy that the first Canadian company that could develop a vaccine against COVID is in Quebec City, in the Quebec City region. We are also very proud that this investment supports the biomedical sector and life sciences sector in Quebec City. It is a very robust sector that promises a lot of jobs. There are roughly 9,000 jobs in Quebec City alone that contribute to this biomedical and life sciences sector. So this is great news for health of Canadians in the context of COVID-19, that a Canadian company can so innovatively and rapidly contribute to the development of a vaccine against COVID-19. But it's also great news for vaccine production capacity for the coming years in Canada. Follow-up. Question. Can I add something to this answer? Minister Anand says, answer. Thank you. I would like to say something about procurement and also vaccine production. The last step of the vaccine production chain will be conducted in Canada, like for all agreements on vaccine candidates. We are allowing the developer to determine the production location, but it is very good news for Quebec and for Canada as well. This investment in Canadian research and also in Canadian business. This is the first vaccine candidate which will be produced in Canada, and that is very important for us, for Quebec, and for the entire world. Thank you very much. Follow-up, Émilie? Question. Yes, on another subject. Perhaps Mr. Duclos could also answer this one. Concerning the contract given to STI Professional, was anyone in the government aware that this contract could raise ethical questions, and were you aware of the link between STI and Melis Medical? Well, listen, answer. Well, I'll give Minister Anand the chance to provide any details on that. I have followed the file. I can assure you that Public Services and Procurement Canada acted appropriately with an open tender, which led to the contribution of 4 different companies to provide artificial respirators or ventilators ventilators in an emergency context, and based on we recall what the first wave looked like at the end of March, when we were facing extremely competitive international competition, and we were also facing the shortage of ventilators. It would be difficult to imagine being in a hospital bed and needing a ventilator and not having one because health services were completely overwhelmed. And that was a real domestic production problem. I will allow Minister Anand to add further details, but I can tell you that because we followed the correct process, if we had not acted in the way we did, the result might have been terrible. Minister Anand. Yes, it is true. Thank you very much, Minister Duclos. I would like to add further details to support this acceleration, innovation in science, and ESDC launched in the spring a call for Canadian producers to help them meet the growing need in our health system. Before that moment, no domestic production of ventilators existed in Canada, and that's very important to highlight. We must have production here in Canada of ventilators and also of personal protective equipment. And once the call was put out, the committee of experts, like doctors, procurement specialists, chose providers, and after this process, we signed contracts with a number of suppliers of ventilators. So there was a process. Our government followed the process, and that is the most important thing here. And now we have ventilators. We produce them here in Canada. Thank you.
Would you like it in English?
Yeah, the Minister Anand would repeat that in English.
Minister Anand, would you like to repeat in English? Yes, Minister. Minister Anand?
No, you're much better than I am in English, Anita.
Mais pas en français.
But not in French.
I will say that it's extremely important to remember that at the beginning of this pandemic, there was no domestic production of ventilators at all. Our provincial and territorial partners, as well as the Public Health Agency of Canada, were extremely concerned that we needed to have access to ventilators very quickly. And the hard work of my colleague, Minister Baines, and his department at ISED was instrumental in building up domestic production, not only of ventilators, but of PPE across the board. And what ISED did was to launch a call out to Canadian manufacturers in the spring to assist with Canada's response to the growing needs of our healthcare system across the board. Following the receipt of proposals through this call out, and after an expansive review by an expert panel of doctors, of clinicians, of experts in manufacturing and procurement, this expert panel made decisions and selected 4 suppliers. After that process was concluded, then PSPC entered into contracts with those suppliers. Therefore, it's important to remember, first of all, we had no domestic production of ventilators. There was a process established by independent experts. Once that process was concluded, then the government entered into contracts with several suppliers for the domestic production of ventilators. There was a problem with domestic production, and the Government of Canada solved it and will continue to work with Canadian businesses to step up for Canadians and make sure that we have the PPE and we have the other medical supplies like ventilators to keep Canadians safe throughout this entire pandemic and beyond if there happened to be another situation like this that befell our country. Thank you.
Thank you, Minister. We'll take one last question on the phone before returning to the room. Opérateur, c'est à vous.
Thank you, merci. Prochaine question. Hélène Buzetti, Le Devoir, à vous.
Question. Yes, good afternoon. My question is for Minister Anand. I would like to know concerning the rapid tests. You received a first batch of 100,000 tests. Why was it sent entirely to Ontario, when Quebec has the worst situation right now? Answer. Yes, that is a very important question. And I would like to say, first of all, that the Government of Canada continues to work with provincial and territorial governments to determine their needs. And we are working with the Public Health Agency of Canada, which is in daily contact with the provinces and territories. And it determines where rapid tests must be sent. But I would also like to say that we will receive a lot of rapid tests here in Canada before the end of the year. Over 11 million rapid tests will arrive in Canada. And that is in addition to the traditional testing system, and that's also very important to recall. And I would like to give the floor to Dr. Tam and Dr. New because they represent the Public Health Agency of Canada. Dr. New, answer. Minister Anand already noted that we have discussed this already. This is a formula that is negotiated with the provinces and territories, with our counterparts, and a formula to distribute rapid tests is based on the population in general, per capita, roughly 80%, and we also keep 20% for the federal government because there may perhaps be an emergency outbreak or where a province or territory needs more testing for a given situation. That's exactly the situation in Ontario. With what is happening on the ground in Ontario, we decided to send the first batch of rapid tests to Ontario, but it's certain that as Minister Anand noted, there will be enough rapid tests for all the provinces and territories.
Well, with all due respect, ministers, you haven't really answered the question. We got 100,000 tests, and it's in Quebec that the situation is worse. Today, Premier Legault is complaining about the fact that he didn't get any tests. So, and Mr. New just said that it was supposed to be a distribution based on population numbers. So, none of this explained to me why Quebec didn't get any of those rapid tests.
Well, I will start by telling you about what I do every day, which is procurement. And I'll speak to the procurement issues and what we've procured, and then I'll ask Dr. New to pick up where I left off. I want to start by saying that we have procured up to nearly 30 million rapid point-of-care tests. 100,000 Abbott ID Now test kits arrived last week and have been delivered, which are the tests that you're referring to. But in addition, we are going to have 2.4 million more ID Now tests to be delivered before the end of the year. More than 200,000 Abbott PanBio test kits arrived this week and are being distributed as we speak directly to provinces and territories, with more on the way. And 8.3 million more PanBio tests will be delivered by the end of the year. So Dr. New a raison, c'est vrai.
Dr. New is right. Yes, we have a lot of tests, and for the provinces and territories as well. But the decisions on where the tests are sent is one that is made by the Public Health Agency of Canada in collaboration with the provinces and territories as well. And on that matter, I would give the floor to Dr. New.
Maybe I can start.
I can just clarify that there has been a arrangement agreement that's already been agreed upon by provinces and territories in terms of per capita allocation of 80% of the supply, together with 20% that is held back in case there's a need for surge capacity. So this is just the first little bit of delivery. And what I was told, I'm not in charge of the distribution and allocation for the rest of the month, for example, but what I've been informed is that every province will get some per capita allocation, and that there is an actual mechanism for provinces to request surge capacity should they need it. So this is, you're just seeing the sort of real-time rollout, I think, of the initial delivery, but there will be more as the weeks and days go by in the next while. So I can't speak to the specific timelines for Quebec, but we know that per capita allocation will occur in the next days.
Answer repeated in French. Dr. Tam has already noted that we already have established a formula for distributing rapid point-of-care tests with the provinces and territories. The 80% of tests will be distributed on a per capita basis, depending on the population of the province or territory, and the government will hold back 20% in reserve to address surge capacity or outbreaks. That is what's happening currently. The deliveries are happening in real time, and it's certain that Quebec and the other provinces and territories, there are other deliveries of tests that are coming, but the very first delivery went to Ontario, and it's certain that Quebec will also receive its fair share of the rapid point-of-care tests that we receive here in Canada. Dr. Tam and I are not aware of the logistical details, but we are expecting more deliveries in the coming days and weeks because there are millions of tests that will be arriving in Canada. And I think that in the coming days and weeks, we will receive them here in Canada and distribute them based on the formula.
Last two questions in the room.
Global News. Minister LeBlanc, a question for you. I know you've been sitting there very patiently. I'd like to have a question, perhaps. You may have heard I asked the Prime Minister about federal-provincial discussions on long-term healthcare standards. I'm not sure I heard a lot of detail there. I wonder if you could add to, is there a work plan? I don't know if it's your department, Minister Haidoo's department. Can you give us a little more detail about what work has been done in the last month with the provinces on national long-term care facility standards?
Sure. So as the Prime Minister, I think, properly noted at the 20th First Minister's conversation just a little over a week ago, this was one of the subjects of discussion. A number of premiers indicated to us that they like the idea of beginning by sharing best practices. Different jurisdictions, as the Prime Minister noted, have had some success. Others have had more challenges. Canadians expect, obviously, governments to work together to protect these vulnerable people in the best way possible. I've also started bilateral conversations with some premiers in terms of what would be their priorities if the Government of Canada were to say, how can we partner to improve standards, for example, in your province, or what would be the priorities if the Government of Canada were to say to provinces, we're prepared to help improve. The Prime Minister, I think, has said, used an example of infection control standards. So right across the board, those conversations are taking place. They're taking place, obviously, with my colleague, Minister Haidu, and her counterparts in provinces and territories. But we're having a First Minister's call again in 6 days from now. So I would expect that subject will be recurring, but we don't wait for those biweekly calls to advance work that we have on an ongoing basis. I spoke to 4 Atlantic premiers this week. My colleague Seamus O'Regan was on the call for a part of the conversation. So it's an ongoing discussion, and obviously we'll continue to do what's necessary to provide the maximum protection that we can to these residents in these vulnerable circumstances.
And Dr. Tam, sort of along the same topic, the Ontario Hospital Commission, or the Ontario Hospital Association, you may have read, testified to that Ontario Commission, that it is worried that rising cases in LTC facilities will put additional pressures on hospital resources, and we now get into canceling of non-elective surgeries and so on. So I wonder if you give me your sense about, are you concerned about mortality rates? Will they be different in long-term care facilities this wave than the first wave? If you give me a sense, maybe any, I don't know if you have any stats, but discussions you might have had with your provincial counterparts on where we stand at this point in terms of the risk to those in long-term care facilities?
I think the highest risk groups in terms of severe illness remains those who are seniors, those who are in the older age groups, and those with underlying medical conditions. And there are also other settings at high risk, but long-term care facilities, of course, are higher risk settings, for sure. And that is that was the picture in the initial wave of the pandemic. So we know that is an absolute area of priority in terms of, the response as the resurgence is occurring right now. So monitoring long-term care facility outbreaks is extremely important. And based on what we have seen, as you can imagine, with increasing number of cases in the community and community transmission, you're going to get more risk of introduction into the long-term care. And so people need to be ready with with screening, with public health measures on an ongoing preventive basis, but immediate testing and rapid testing of those settings as soon as you think you have an outbreak or the initial cases. So that is what the expectation would be with the current guidance provided. What we have seen is that the numbers of long-term care facility outbreaks have increased, including in Quebec and in Ontario. The size of the outbreaks are smaller than in the initial wave. But I'm not sure exactly what that means. That could be people identifying things more rapidly and putting in control measures, and the prevention is better. But you have to watch this space really carefully. And so we can't jump into conclusions at the moment, but it is an important indicator because it will be ahead of the lagging indicators of hospitalizations and, of course, mortality. And so if we're spotting long-term care outbreaks now, it's very likely that increase in numbers of hospitalizations and deaths will follow. So it is an extremely important space to be concerned about. The second issue is the healthcare system capacity. That is another indicator being tracked by provinces and territories, because at a certain point, it does mean canceling of elective surgeries to make room for a potential increase in cases. So again, that's a provincial jurisdiction, but it is one of the indicators that they're tracking as well.
Tam, you heard the Prime Minister being questioned about the evacuation of a First Nations in Northern Ontario because of drinking water problems. This is the second time it's happened in that community. Do you consider this now, the problem there and in other First Nations, to be a public health emergency? And if so, have you spoken to the Prime Minister about this or his Indigenous Services Minister about trying to do something about this, the drinking water situation?
This has been a primary focus of my colleagues in Indigenous Services Canada, so including Dr. Tom Wong, who is their medical advisor. So if you need anything very specific, I would suggest that you speak to Indigenous Services Canada. But as we all know, the impact of the pandemic is not only due directly to COVID-19 itself and the virus that causes it. You have to monitor overall health and health impacts for the populations that we're trying to serve. So you cannot forget, the other risks that may be in different communities. So as much as possible, you're going to have to look at everything in a holistic way. What the Prime Minister sort of highlighted was if there are actual barriers, for example, there's COVID-19 in a community, of course, that could delay other measures. But this is a chronic issue. So what you don't want is an acute on chronic problem where while you're trying to solve the chronic infrastructure and other issues, you could get outbreaks, other outbreaks that could happen. So that has to be watched very carefully. But it is, of course, a public health issue.
A quick question. We spoke, a number of colleagues in Quebec, given that it's the largest outbreak, why did they not receive the test first, the rapid testing?
I don't know the
answer.
Specific logistics to it, but it's something that is transparent and it's up to the province to make requests if they need to, but there's a per capita allocation. So I don't know the details of which day something arrives in each province. So that is something that we could get more information on. But it will change day by day because I don't know the delivery dates of each of those. There's different rapid tests as well. But there are mechanisms that are agreed upon by provinces for the allocation. And so and if more needs to be requested, there is an actual process you can apply for to get the extra surge capacity. So I don't personally know what Quebec has asked for, so we can get back to people on that, different teams. Yeah.
Answer in French. There are mechanisms that currently exist for a discussion between the federal government and the provinces and territories, and Dr. Tam and I are not really aware of the ins and outs of the logistical discussions, but certainly we could come back with additional information and make that available to you. Thank you.
You always say your decisions are based on science, right? And science, as we all know, always is evolving. What firewalls have you built to make sure that political side can't affect public health experts, and so Canadians can have confidence that science not being co-opted for political reasons?
Well, I think throughout the pandemic, I work very closely with other medical officers of health, and we have established mechanisms to review the science and put out guidance. So that is a key aspect of our job. But there are other expert committees that are also external to the agency, and they have processes in place to make their advice. For example, the upcoming advice for vaccines involves the National Advisory Committee on Immunization, and they make their recommendations. And that's what we have to present to decision makers, recognizing that science is the foundation, but there are many other considerations, be it logistical or otherwise. And so that will be up to the decision makers to take it. It's a complex decision-making process. So we try to the science is evolving, as we just said, and sometimes it's not entirely clear. So that has to be taken into account as the other factors when people make decisions. But we have, long-standing mechanisms. The regulatory authorities have been emphasizing we have a regulatory process for reviewing data and clinical trials and established processes for submission. And in the time of an emergency, there are emergency regulatory mechanisms, but does not mean we compromise on safety and on the process of the review. We just have to do it faster and then sort of rolling and ways instead of sequentially. And so that is something that Canadians can count on. We will tell you if we don't know something too. I think that's very important.
Merci beaucoup. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you very much. That marks the end of the press conference.
If you're just joining us here on CBC News Network, we've been taking you live to Ottawa, where the Prime Minister and the top health officials in this country have just been holding a press conference about vaccine production and distribution in this country. So lots of details to go through.